Good morning, dear subscribers. Welcome back again after a long time of no see. Today I will be talking about a monster of the 21st century, which is obesity. As most of you have required such a video from me, I have decided to make it to you now. Let's start. When we talk about the obesity, we start by the definition. Obesity is the deposition of fat under your skin and inside your viscera. We call the fat adipose tissue in medicine. Now comes to the prevalence of obesity. Actually, the country in which I am living, Egypt, has the highest rates of obesity in Eastern Mediterranean region and Africa, according to the International Obesity Federation. Obesity in itself is not just a problem of psychological or your shape, like some of you think. It's actually a very big problem and it causes a lot of medical conditions, starting from diabetes and hypertension and dyslipidemia, which are well known to all of you that are caused by obesity, to others such as glomerulonephritis, and it damages the kidney. The gastrointestinal tract can also be damaged, and the liver, causing gallstones and steatohepatitis. The lungs, even your lungs, can be damaged by obesity. Some of the people who have asthma is exacerbated by obesity, and actually one of the conditions that is very considering for the world nowadays is obstructive sleep apnea, that has a very high prevalence in Egypt and all over the world. Obstructive sleep apnea in short is a condition in which your upper respiratory tract closes during sleep and the respiratory center stops working, and this leads to decreased brain oxygenation. You wake up so weak and tired, you can't do your work, all of that because the brain oxygenation is reduced during sleep due to obstructive sleep apnea. It was shown by researchers that obstructive sleep apnea is caused by obesity. And now let's turn to your musculoskeletal system. Your exercise rates and your bones are actually affected by obesity. Obesity decreases your endurance to exercise, and it also increases the risk of fracture and pathological fractures of your bones, as your elbows. When it comes to the endocrine system or endocrinology, obesity actually affects the endocrine system and affects the reproductive system in specific. There is a syndrome called polycystic ovary syndrome, which happens mainly in females. It leads to infertility because of many cysts in the ovaries, and in general this syndrome was shown to be associated with obesity. Not that only, but also in men. Obesity may lead to infertility because of hypogonadism. Now let's turn to the causes of obesity. Some of you think that obesity is only caused by diet or dietary problems. No, it's not just that. Some people have obesity due to clinical problem or clinical conditions that's leading to increasing their body fat, such as hypothyroidism and Cushing. Hypothyroidism is the decrease of the hormone secreted from this gland, thyroid hormone. This thyroid hormone is responsible for the food breakdown. The decrease in the hypothyroidism or the decrease in the thyroid hormone leads to obesity, and the increase in the thyroid hormone level leads to thin stature. Even when the person eats a lot of food, he doesn't gain weight, he doesn't get fat. And now let's turn to the genetic causes of obesity. Some of you think that obesity is inherited from mother to son or from father to son? And yes, it actually has a genetic inheritance. And we see a syndromes that is associated with obesity in children, like the Prader-Willi syndrome and the Bardet-Biedl syndrome. Now we get to a very important point, which is the criteria for the diagnosis of obesity. How to say that this person is obese or not. And it's actually not easy to say someone is obese or not. So we have put a criteria based on which we can say this person is obese. First and foremost is the body mass index. Some people think that weight is enough to say a person is obese or not, or weight is a good measurement tool. No, it's not enough, and it's never the weight that determines whether you are obese or not. But it's actually the skin fold thickness and the body mass index that determines the fat in your body. Body mass index is calculated by dividing the weight in kilograms over your height in meters squared. And it depends on the result of your body mass index. If you are between 20 and 25, it's acceptable. If above 25, you're overweight. If above 35, you are obese. When it comes to the skin fold thickness is actually measured in the clinic using a specific device as shown to you. And the waist circumference is also a reliable measurement tool, which is specifically important in calculating the cardiovascular risk score. Some people say that if your waist exceeds 80 centimeters, then you are at risk of heart disease, especially coronary artery disease and other cardiovascular diseases like stroke. When it comes to the bioelectrical impedance, this is a device that measures the resistance of your body to electricity, and it is specifically important to determine the fat percentage in the body. As you know, fat is an insulator to electricity, so as fat increases, your body resistance to electricity increases. And now, the obesity investigations. First, we do some basic investigations like full CBC, free T4, TSH, fasting glucose, fasting lipids, liver function test, and even ECG. All these clinical tests is used to first exclude the presence of another clinical syndrome causing obesity, and second, to prove whether there is complications from this obesity or not, and to treat it. There are two types of obesity, two major types. One type that's more in males, which is called android obesity. Sometimes we call it in medicine the apple-shaped obesity. Why we call it the apple-shaped obesity? Because the body fat is collected in the abdominal area, and this is called like an apple. That's why we call it apple-shaped obesity. The other type is the pear-shaped obesity, because the body fat is accumulated more in the waist and the hips, so it looks like a pear, and we call it pear-shaped obesity or gynoid obesity, and it happens more in females. Now time for treatment and time for diet. You may ask yourself, shall I start now? Yes, you shall start now. And you shall start first by improving your diet. How to improve your diet? First, you can go to any website of calorie calculator, write calorie calculator on Google and go to any website and write the types of food to the website, and it calculates for you the amount of calorie you take per day. You need to decrease these calories by 7,500 kilocal to produce a weight loss of 1 kilogram. That's why we divide it on the weekdays, saying that we decrease your fat intake by 1000 kilocal per day, and this decreases your body weight by 1 kilogram every week. And guess what? There is a good news here. Actually, the fat people get thinner easier than the thin people, because the rate of weight loss is higher in fat people due to the presence of more adipose tissue or fat tissue, which burns itself more easily. Now we have came to a very important point. Which food shall I take and which food shall I avoid? And here comes the importance of the pyramid food intake, or the pyramid that is designed by the National Health Service in the United Kingdom to say which food you need in greater amount and which food you need in less amount. The greatest amount of food you need actually is the food you take for decreasing the feel of hunger. That's like cereals or whole grain foods, plant oils, the corn, the sunflower, the peanut, and the vegetable oil. All these foods makes you feel satisfied and less hungry. Then comes the importance of fruits and vegetables with its inclusion of vitamins, minerals, and all the body needs. You need them actually 2 to 3 times per day, somehow slight less than the cereals and other corn and sunflower peanut oil. And then the next step is nuts and legumes. Actually, all of us, I know it's expensive, but all of us needs the nuts daily to prevent cardiovascular disease events from occurring. And this is proved scientifically by many studies that the nuts decrease the levels of atherosclerosis inside your body fats, but of course in moderate amounts. You need to take nuts 1 to 3 times daily. And then comes the next step, which includes the fish and the poultry. You actually need it once daily, only once daily. You need like a quarter of a chicken or 1 fish per day to take your levels required from vitamins as B12 and proteins, actually, which is very important to build our muscles and other body cells. Then comes the importance of the daily intake of calcium and milk, and this shall actually also be taken once daily during the breakfast, and enough for that you either take milk or take other dairy products like yogurt or cheese. Then the last step in our pyramid is meat. Actually, you're not required to take a lot of meat, but you shall not stop it completely, because meat contains vitamin B12, which is necessary for your body. You shall take the meat, as once weekly or something like that. Instead of the poultry or fish, 1 day in the week you can take meat. And I always say that taking multivitamins with your diet is better to be in the safe side, because vitamins deficiency can be very serious and can cause very serious diseases and illness like hemorrhage, severe bleeding, and even cancers can be caused by deficiency of some vitamins like vitamin D. Now the most important step in our pyramid is the exercise and daily walking. You shall go and exercise. If you have a garden behind your home, you shall go and take a round around it. If you don't have a garden and you can get yourself a treadmill and exercise on, let me tell you how to use a treadmill properly to do a proper exercise. Actually, you need to reach 50 to 70% of your maximum target heart rate. The maximum target heart rate is calculated as 220 minus your age. So you will calculate 220 minus your age. For example, if you are 20 years, 220 minus 20 equal 200. Then you calculate 50 to 70% of this. For example, if you are 20 years of age, we said 220 minus 20 equal 200, then 50% of 200 equal 100. So you will walk until your heart rate becomes 100 beats per minute. Now comes the role of acupuncture. Actually, acupuncture role is debatable, but most of the people said it works and others say it has a placebo effect. Actually, we will put the acupuncture, as you see here in this part of the auricle. We add a slight micro needle called the acupuncture, and this decreases the feeling of hunger. It works actually on central receptors of the brain to decrease the feel of hunger. Another device that's used frequently for treatment of obesity is the massage device. Massage devices, as we know, works by vibrating this area, and this increases the energy of the fat molecule, so it becomes burnt out and transferred into heat. This device is particularly useful when you need to shape a part of your body. If obesity is accumulated in a certain area and you need to shape this area and decrease the fat cells in this area, then you use the massage device in this area. Also, for body shaping, there are a lot of other techniques that are used nowadays, like the sonolyze, for example. It uses ultrasound to break fat cells in certain area, so shaping of this area. And another new device used is the seletone, and the seletone works by stimulating the underlying muscles below the fat in this area, increasing the fat burnout to produce energy for the muscles to work more. And even we have got a more sophisticated devices, right? The radio frequency removal of fat area by radio frequency to break down the fat, and the LPG. The LPG is much more sophisticated fat lipolyzer, but it works very, very good and proves to have a very excellent results in shaping the body. Now comes two parts that I actually don't prefer, which is the use of drugs to decrease the obesity. Because we have a lot of drugs, but these drugs have a lot of side effects. One of the drugs we use to relieve obesity is amphetamine. Amphetamine decreases the appetite centrally. It works on central receptors in your brain to decrease your appetite and increase the fat burnout. But take care for hypertension and addiction, because they are a very common side effects to occur with amphetamine. So you can take amphetamine if you have any cardiovascular disease or cardiovascular risk factors. Fenfluramine is another analog that's actually produced to decrease the appetite centrally, like the amphetamine, by inhibiting serotonin reuptake. It works on another pathway, which is the serotonin pathway. You know, fenfluramine is good that it improves the mood, and it's actually an antidepressant, but it has fewer effects than the amphetamine in this area. Sibutramine is another drug that increases both serotonin and norepinephrine. But you know that worked on both sides, the ones that worked on the amphetamine and the ones that worked on the fenfluramine. So it has a better effect than both of us. But actually it has the same side effects of amphetamine. And that's why we can give it to any cardiac patient or any patient who is susceptible to tolerance. Orlistat is an inhibitor of intestinal fat absorption. You know, orlistat works on your intestine. When you intake food, it prevents the reabsorption of fat from the food into the intestine. And this is actually disastrous because it is not only the food that's not absorbed. Some vitamins are also not absorbed, like vitamin A, vitamin D, vitamin E, and vitamin K. These vitamins deficiency causes serious bleeding and affect your vision, as well as precipitating to a lot of cancers. That's why orlistat is not preferred for obesity. And new analogs are made like Victoza. Victoza is a GLP-1 agonist. It works on a totally different pathway that's used also for the treatment of diabetes, not just obesity. And this is an incretin mimetic, increases the level of incretin, and this decreases the intestinal absorption of fat and also decrease the feeling of hunger centrally. That's why this drug is very effective. But on the other hand, Victoza is proved to be leading to a high risk of medullary carcinoma of the thyroid gland. It causes cancer in the thyroid gland. That's why we can give Victoza to anyone who have a thyroid gland problem or who have a previous family history of cancer in the thyroid gland. Regarding the recombinant leptin, leptin is the hormone of feeling, the hormone that's responsible to decrease the feeling of hunger. So recombinant leptin is used in cases of leptin deficiency. It is the hormone of the satiety. You feel satiety because of the release of leptin in your body. Solapigron is a beta-3 adrenergic agonist, which is actually a new analog for treatment of obesity. We don't have enough data on it. It's in the phase of clinical trials, so I can say whether it's good or bad for your health. I haven't actually seen its effect on many people. And now let's continue talking about the surgical treatment of obesity. Regarding the surgical treatment of obesity, we actually have two solutions. The first is surgical operations or the laparoscopic operations, which is done, and they are four actually according to the American Association of Bariatric and Metabolic Surgery. The first is the gastric bypass surgery, the second is the gastric sleeve surgery, the third is the adjustable gastric band ligation, and the fourth is the piliopancreatic diversion. The other solution is the transesophageal endoscopic solution. It can be used for two modalities. The first is the balloon, the inflation of a balloon inside the stomach to reduce its size. And the second is the endoscopic gastric plication, which is done using an endoscope, and it's similar to the sleeve operation. First, let me start by the gastric bypass. The gastric bypass actually has a lot of advantages. It causes significant weight loss and restricts the amount of food that can be consumed. It makes you lose about 50% of your weight or even more. And it produces a favorable change in gut hormones that reduces the appetite and enhances satiety centrally. But on the other hand, there are always disadvantages. The disadvantage of the gastric bypass surgery is that it is technically complex and it leads to vitamins deficiency. Some of them may be so serious, like vitamin B12 deficiency, which causes neurological problems. And another problem, like pernicious anemia, and it may predispose to even cancers. So here it is required to take long-acting vitamin therapy. You take vitamins and multivitamins throughout your life after the gastric bypass surgery, and that's why it is not a preferable surgery. Then came the sleeve gastrectomy surgery. The sleeve gastrectomy actually restricts also the amount of food that you can take, and it has a very efficient weight loss, reaching up to 50% as the previous operation, and it involves a short hospital stay. I know a lot of people personally who made this surgery and they were discharged from hospital after around 2 days and everything went well and everything is okay with them. And it also decreases the satiety, increases the satiety, and it decreases the hunger feeling centrally. But on the other hand, its disadvantages are that it is non-reversible and it has a potential for long-term vitamins deficiency, just like the previous operation, and you need to take multivitamins, maybe not throughout your life, but for a relatively long period of time. Also, some people after losing weight starts to gain weight again after the gastric sleeve or sleeve gastrectomy surgery, and this may be due to the non-restriction to diet, and they return back to their normal, and so the stomach dilates again and accommodates for food again. Now let's turn to the adjustable gastric band surgery. Actually, it is not preferred. Why? Because in the adjustable gastric band we introduce a foreign object in the stomach, and this is not preferred for a lot of surgeons. As we all know in medicine, we try to avoid the introduction of foreign bodies inside the patient. But on the advantages, it is reversible and adjustable, and it has a very low risk of vitamin deficiency. After this operation, you may not need to take multivitamin pills. So that's why it is preferred, and it is still done nowadays, but the introduction of foreign body remains the problem. It also can have a mechanical problems, such as band or tube port in the small percentage of patients. In other patients, it can lead to dilatation of the esophagus and the GERD problem. That's why it's not preferred. And it also requires a strong adhesion to post-operative diet and the post-operative follow-up visits, and has a high rate of reoperation. That's why if you did a gastric band, you may need to redo the operation again. But you can go out of the hospital after 1 day or 24 hours after this operation. It requires less hospital stay. It causes the decrease of weight of up to 40 to 50%, and reduce the amount the stomach can hold, and also improves the satiety and decrease the hunger feeling, and it has low rates of mortality. Now let's turn to the biliopancreatic system dilatation. And in the biliopancreatic system dilatation, the most effective against the diabetes compared to the other operations. That's why we use it and prefer it actually for diabetic patients. The biliopancreatic diversion, the most effective for diabetic patients. It causes a favorable change in the gut hormones to reduce the appetite and improves the satiety. And it reduces the absorption of fat by 70% or more, and allows the patient to eventually eat near normal needs. So you eat normally and you don't get fat. Oh, that's like magic. It results in a great weight loss up to 70%, which is much more than the previous operations. But on the other hand, everything has disadvantages, as I said before, and the disadvantage here is the high complication rate and the risk of mortality. It has very high complication and risk of mortality, actually higher than all the previous ones, and it requires a very long hospital stay, and it has a great potential to cause protein deficiency, and long-term deficiency in a number of vitamins, multivitamin deficiencies and multimineral deficiencies, including vitamin A, vitamin D, vitamin E, and vitamin K, as I said before, which are important for your vision, your bones, and they are important also for the coagulation factor formation. Their deficiency leads to serious bleeding. That's why we need to avoid it. And it needs also compliance with follow-up visits, which is horrible. I always hate to follow up with doctors and need to go through the doctor clinic and every now and then. That's why it's preferred only for the diabetic patients, as I said before. The other endoscopic are the gastric plication. It has the same disadvantages and advantages as the sleeve operation, but of course it has much less hospital stay. You may don't need to stay at hospital at all. After the operation you go out because it's done transesophageally through an endoscope. And on the other hand, it has higher rate of recurrence than the operational gastric sleeve. The other hand is the balloon. The balloon actually had a great problem which may lead to stomach perforation and esophageal perforation. Actually, I have a relative or someone who did this operation, and he had this complication, and it was horrible. It causes severe gastrointestinal bleeding and severe anemia, and he needs to go to the emergency room as soon as possible to repair the perforated vesicles. Now let's turn to the nutritional balancing. Actually, what I mean by this slide is the most important part of our series today. We have talked about nearly everything: what to eat, what to avoid, and how to exercise, devices used to relieve obesity, surgical operations to relieve obesity. But do you think any solution you will do will be final, or you need to maintain? Maintenance is the key here. You need to maintain. You need to maintain diet and to maintain an exercise routine to keep your weight stable and low as possible. You need also to maintain exercise and the diet to clean your cells out of toxins. Because as you see here on the screen, dieting and calorie cutting or exercising result in fat loss, increasing the toxic density, and this result to rebound toxic overload and triggers the body need to create fat. So weight is regained again once you eat more. But if you made a diet and these toxins are released, which trying to make you more fat, but you maintained that diet and you didn't eat more fat, so no more fat will be deposited in your body, and excess toxins will be removed and cleaned by the muscles and melt away during the exercise. And maintaining this routine keeps your nutritional balance and keeps your body naturally clean while cleansing and managing the toxins. So people, here is the most important advice. Once you start a dieting routine or an exercise routine, please try to maintain and keep doing this routine throughout your life, because once you stop, you will get more fat than your previous state. And thank you for watching. Was with you, Mostafa Sedky.
Please like and subscribe to my channel.